Welcome, guys, back to another bangarang. Well, let me see what happened yesterday. Hey, the news flash. PNP representative no calling for sack the health minister and SRHA chairman. Now, me want to know when him get sacked, will they have a monkey to replace him? None of them no better. Swapping black monkey for dog or swap dog for black monkey is not the answer. So today's video is about a big problem that Jamaicans are faced with. And how that's going to be solved, me no know. So the calls for the resignation of the health minister and the chairman of the Southern Regional Health Authority have been made by some political representatives in Manchester. They're not pleased with the hospital. They're not pleased with what's going on in the health system. Because, imagine, you have a hospital in a Mandeville and not do they for help the people in. I can tell you, because me come from Manchester, and I can tell you stories about people that the Manchester, that hospital feel, which things happen where shouldn't happen. And at the time when these things happen, I used to think it was a good hospital. But now I'm beginning to realize that lack of equipment and all is something there. Things now run right there. It is a bit late in the night. I'm doing this video, and I have to wonder why do we have a solution to the health system? It reached a stage now that I don't know what is going to take them out of this crisis that the healthcare system is under now. Healthcare system is under attack. It is under attack from negligence. The ministry, the calls have come after the Ministry of Health revealed that the maternal mortality rate in the SRHA skyrocketed from 27 per thousand per 100,000 to 273 per 100,000 women. It is unacceptable. This is unacceptable. People's lives are important. People's lives are at stake. Children's lives are important. Children's lives are at stake. The ministry attributed a sharp increase in the country's maternity mortality rate to COVID-19. May I try to listen? It looked like me have to turn on the TV or the radio to find out if COVID still a gone. Me think say COVID-19 was behind us. No. So how is COVID being blamed for so many newborn deaths? Are so many women dying? Was it COVID that killed the newborn that lungs wasn't developed because he was premature and there were no ventilators in any of the hospitals last week? By the way, is COVID still a crisis in Jamaica? If COVID is what is causing this major issue, shouldn't US and other countries be facing the same problem? But in 2011, and 11 of 19 maternal deaths were attributed to COVID-19, and by 2022, 2 of 18 maternal deaths were said to be COVID related. The cause has also been triggered by the unavailability of a ventilator at Maypen Hospital in Clarendon and staff shortage at the nearby Mandeville Regional Hospital, issues which were blamed for the death of a newborn earlier this month. In light of these developments, Mayor of Mandeville, Donovan Mitchell, said both Health Minister Dr. Christopher Tufton and SRHA Chairman Wayne Chen should be sacked, as I don't think it will as I don't think it will be better. No. According to him, he thinks the Prime Minister of Jamaica should relieve Minister Tufton of his responsibility and relieve the board of the Southern Regional Health Authority and find competent people, because it therefore means that they have not been watching what has been going on. He contended, adding that the people of Manchester, St. Elizabeth, and Clarendon deserve better. And yes, I have to agree with him. He is far removed from the situation. He did not have a count on the ventilators in the hospitals. He had no idea until this baby died. He asked for a count and came up with the wrong amount. Embarrassingly. And it looked like he never even feels shame about it. Now, if you have an employee and the employee don't know what is going on around him, you call the employee and you say, listen, X, Y, and Z. And they come up with, when they do come up with an answer, then come up with the wrong one. What would you do? What would you do? Would you keep them there and promote them and pay them more money? Or would you fire them? That is the big question for the Prime Minister. Something needs to be done. Something needs to be done, because if the man did it, I collect big money and don't know how much ventilator in there, assign it when this thing come up and come out in the open, assign it to somebody to find out how much hospitals that are Jamaica that they couldn't get a good count. And he couldn't get a count. What he said is a fact, that we used to praise the Mandeville Regional Hospital. We used to praise the Southern Regional Health Authority under the chairmanship of one Mrs. Fairбell. And he said that he is not only speaking because he's a politician, but speaking because he's concerned. Meanwhile, imagine the People's National Party caretaker for South Manchester, Senator Peter Bunting, dismissed any argument attributing to the increase of death toll to lack of funding. So that means funding must be there. If him a dismiss it for lack of funding, because they say lack of funding, then there's something that him know that others don't know. Me not dispute that about the funding, because healthcare is expensive, but so should it be a priority. Without health, there is no life, and without good medical, there is no hope. Them say that what happened in a darkness must come out in a light. And it is really coming to light that there are major issues with the hospitals. PNP calls on government to come clean and ICU capacity available island-wide. But when you point a finger at someone, one finger point back at you. PNP is just as guilty. If them did leave the hospital in good standing, it wouldn't run down so quick. Opposition spokesman on health and wellness, Dr. Alfred Dawes, is calling on the Ministry of Health and Wellness to confirm or deny reports that in spite of 210 registered ventilators in the system, there are less than 40 adult IC intensive care unit beds available island-wide. 40! When there are so many accidents and all and something on the road. 40 ICU beds in the whole island? Come on. This is shocking. Noting that the ministry has avoided answering direct questions about the island ICU capacity. Dr. Dawes questioned before the pandemic, there were less than 35 proper ICU spaces, not counting makeshift recovery room spaces. According to reports, there are about 35 proper ICU spaces in the public health system. Why has the MOH double not included this information in their report? Where them hide? According to Dawes, The failure to significantly upgrade the country's ICU capacity is further testament to the lack of prioritization of critical care by the ministry. He said that with the massive injection of cash into the system seen during the pandemic, there is no valid reason the country should have less than 40 ICU beds for a population of just under 3 million residents and 4 million tourists visiting annually. And you have 40 ICU beds. So why the other people them go on the floor or in the regular unit? The opposition spokesperson said the lack of ICU beds delays critical surgeries such as neurosurgical procedures and complex cancer surgeries. He further complained that countless trauma, stroke, septic, and post-surgery patients have died awaiting ICU beds that are never materialized. This is a shame. This is a big, big, big disgrace. What people go into politics for? To enrich themselves? And then forget. Some of them come from poor background and then forget where them coming from. At any given time, there are several patients awaiting an ICU bed to give them a fighting chance at survival. As a result of the limited capacity, the staff have to make their heart-rending decision of who gets to live. Can you imagine the burden on the staff? Two people come in and them have to decide, say, listen, no, this person can live and this person can die. No patient, relative, friend, or healthcare worker deserve this status quo, Mr. Dawes said in a release. Boasting about the largest number of ventilators ever means nothing if the infrastructure, staffing, and required equipment are not put in place to create sufficient critical care facilities island-wide, he continued. Dr. Dawes said the health ministry needs to state clearly the country's ICU capacity and outline the steps being taken to increase that capacity to meet the demands of the population. And Prime Minister wants probe expedite after the fatal equipment failure reported an overall health system submitted. Prime Minister Andrew Holness says the Ministry of Health and Wellness has been told to expedite investigation into the deaths of a newborn at Maypen Hospital in Clarendon and a woman at Falmouth Hospital in Trelawney. And I know people talking about the healthcare system, but they just used to grumble underneath them breath. Social media is good and it is bad. In this case, it is bad because the world is watching, and it is good because it's good because they, meaning the people who are in charge of making sure there is a proper healthcare system, is taking some actions. They are looking now. When the US government put the warning on their website some months ago, telling their citizens about the healthcare in Jamaica, they were actually denying it. But now that people are speaking out about their experiences, getting nervous about it. Anyway, guys, if you have watched the video this far, make sure you subscribe to the channel and share the video. See you back here.